All right, that was my personal 15 minutes, my Horizon moments. Now I'm just going to be presenting the speakers, and I'm very happy to introduce to you Caroline Dorsen. She's Associate Dean of Clinical Partnerships, Clinical Associate Professor at Rutgers School of Nursing and Public Health. I'm going to read a little bit of her bio. Also, forgive me that I'm not a native speaker, so I say some words that are maybe a wrong pronunciation. Caroline Dorsen is a nurse, scholar, educator, and clinician whose passion in the intersection of physical health, mental health, substance use, and social justice. She was a faculty member at NYU for 15 years before joining Rutgers School of Nursing as an associate dean in 2020. She has worked as a nurse practitioner over 20 years, and she currently serves as vice chairman of the board of directors of the Community Health Network and is a senior associate of the editor of the journal Annals of LGBTQ Public and Population Health. She has been a member of numerous diversity, equity, and inclusion task force, including the HH Office of Minority Health, and is a member of the Psychiatry Mental Health Expert Panel for the American Academy of Nursing. Along with her research related to the impact of bias on health inequity, Caroline's research has focused on the underground uses of psychedelic medicines for health and healing. And the title of her presentation is Community Medicine. Please welcome Caroline.
Obrigada, Bia. Obrigada. That's it for my Portuguese, but I really appreciate the introduction. And I'm so thrilled to be here with all of you today. I am speaking today on behalf of myself and my dear colleague, Dr. Billy Rosa. Sorry, I see we're having some technical issues. And the goal of my presentation is to lay the groundwork and to think together a bit about the role of community and connection in psychedelic science. I am certainly going to ask more questions than I am going to offer solutions. That is the academic way. So before I begin, I would like to just take a moment in this season of gratitude to express a few things that I am grateful for. I am incredibly grateful to be here with all of you. 8 years ago, when I gave my first presentation on psychedelic medicine, there were exactly 6 people in the audience. There were 3 committed psychonauts on one side of the room. There were 3 people who I can only describe as thinking that I was committing some kind of medical blasphemy by even talking about this on the other side of the room. I lost control. There was an argument. It was a complete disaster. So I feel like I am coming home to be here with all of you. Whew. It's okay. I'm also really grateful to my nurse colleagues and other essential workers who have been caring for us in the past 20 months. As Bia said, I myself am a nurse, and I work exclusively in the community, and so I can only imagine what everyone has been going through. But they have kept us well, they have treated us when we're ill, and they have helped us die with dignity, and they really are heroes. Lastly, I would just like to say I am grateful to live in such a beautiful and complicated world. I take a moment every day to look at a picture like this, given that I live in Brooklyn, New York, and it doesn't look this way, but look at the sky, look at the ocean, look at the mountains, and look at the trees. I acknowledge that I am standing on the unceded land of the Lenni Lenape people. I also acknowledge that I am speaking from a place of incredible privilege as an educated white cisgender woman, and my intention is to co-create an environment and community of inclusion, but I sometimes fall short. And when I do, I ask for feedback, and I ask to be held accountable so that I may do better as we move forward collectively. Lastly, I just want to thank my wonderful colleagues at NYU. I miss you all. So let's start today with this picture, and you've probably seen this picture before or one like it. This is an early psilocybin session. This is from Hopkins. And what I'd like to point out today is how many things the researchers are doing right in this picture to create a safe container and a soft landing for this patient. This looks like someone's nicely appointed living room. There is a blanket, there is a pillow, they're listening to some nice music. The eye mask tells me that these researchers are giving this patient space to go inward and do what they need to do. But the two present practitioners, one who has their hand lightly on the patient, is telling me that that patient also knows that someone is there for them should they need to be guided or should they need help. Because I'm the first speaker of the day, I want to ground us in what the data is telling us, and you probably all know this, but the results of those early clinical trials are quite miraculous. I've just pulled out 2 data points here, and there are many, many others, but these are 2 that really pull my heartstrings when I think about how unsuccessful we have been historically in treating addiction and mental health in this country and internationally. On the right side, we see that after a psilocybin session, 6 months afterwards, 80% of a very small number of people, but patients who had struggled with tobacco addiction before, 80% are abstaining from tobacco use. On the left-hand side of the slide, what you see is that we have similar data around depression and anxiety. So 6 months after a high-dose psilocybin session, we see almost 80% of people who participated in that study have a clinically significant reduction in depression symptoms, and over 80% have a clinically significant reduction in anxiety symptoms. So how does this work? And this is one of my favorite topics, and I'm just going to very simply talk about some of the multiple pathways that people are exploring when we think about why psychedelics are helping so many people. Is it because on the left-hand side they are increasing circulation of neurotransmitters that make us feel good in the brain, serotonin, dopamine, etc.? Is it because people are having mystical experiences, and those mystical experiences are helping us feel one with the world, feel like we're part of a plan, feel that we're connected with ourselves, with spirit, with other people? Is it because of neuroplasticity, that connections in our brains that have atrophied because of age or trauma or stress are now reconnecting, allowing our brain to function better than it was previously? And or is it because of another pathway, a pathway that many people are calling relational health? And this has to do with a pathway that helps us regain social connection, decrease isolation, and there is incredible data about this if you look for it in different studies. There is certainly a lot of data that says that social isolation, as this article says, is killing us. What we see is that loneliness is linked to higher rates of depression, anxiety, suicidality, substance use, falls in the elderly, dementia and cognitive decline, cardiovascular disease. And we also see that this is all getting worse during COVID. These numbers are really scary to me as a healthcare provider. What we see in these is that before COVID, in January of 2019, somewhere between 8 and 11% of people were talking about having symptoms of anxiety or depression. And in the middle of COVID, last December, those numbers were like 37 to 43% of us. And I don't want to pretend that these numbers are skyrocketing only because of social isolation. This is also because of fear of illness or illness itself, financial problems, work problems, all of those things that we've all experienced together. But I believe that a certain amount of this anxiety and depression does have to do with the social isolation that so many of us have experienced in the past year and a half. So this leads me to the central question of what I'd like to talk about today. And that is, if our real disease is a crisis of connection, then what is the solution? Could community and connection be the treatment for what ails us? Could community and connection prevent some of these problems? And furthermore, it leads me to think, despite promising clinical trials, perhaps this structure is not the optimal structure for treating depression, anxiety, and addiction. Or perhaps this is not the right structure for everyone or for every diagnosis. Could working in groups like underground psychedelic groups, but also like all of the groups that people participate in group therapy and 12-step and so on, could groups provide benefits that individual treatments have not been able to up until now? And as Bia was talking about, would groups allow us to scale up our efforts to reach more people, given those huge numbers that we just saw in the previous slide about the number of people that are suffering in the world from addiction, anxiety, and depression? And certainly, as we learned today already, and as we talked about earlier in the conference, we know that these underground groups are happening all across the world. When you look at the number of psychedelic societies in North America, in Europe, in Latin America, they are springing up everywhere, and the vast majority of people who are participating in them are not also participating in medical settings, in clinical trials. These are people who are taking their health into their own hands in order to search for healing. All of these questions led me and my colleagues to think about how we could find some data to help support our thesis that connection is the disease here. Connection, is the treatment for the disease. So we looked back at a study that we did in 2016, and we did something called a secondary analysis of the data. And a secondary analysis of the data means this was not one of the original questions that we asked in this study, but we thought we had some good questions that could help us think about data that we were hoping to find. And the aim of the secondary analysis of data was to try and understand how participants spoke about community in the context of underground psychedelic groups. The original study, just to give you 2 minutes on that, was a small study. It was only 15 people. It was a modified ethnography that we did in the US. And that means, as an ethnography, that we were using many of the tenets of anthropological research. This was a qualitative study. We weren't looking for lots of fancy statistics, but rather we were collecting the stories of people who were participating in underground psychedelic ceremonies in the US and asking them some questions about why they chose to participate. What were the perceived risks of participating, and what were the perceived benefits of participating? We were particularly interested, given how early this study was, in trying to understand how people differentiated recreational use from ceremonial use. The main finding of the study, of course, is that people did not think that psychedelic drugs were recreational drugs. Rather, they saw plant medicine as a self-care and healing modality to be used in the context of community and ritual. And when we looked at the words that people used, we were struck by how diametrically opposed they were to the words that people usually use when they describe drug use. So usually people say, I went out, I went to a club, I used some drugs, I had fun, I wanted to check out, I wanted to forget my problems. The words could not have been more different. People were talking about wanting to go in, wanting to face their problems, wanting to heal their trauma. And throughout their words, people talked about community. They talked about community as part of the intention for why they were participating. They talked about community and connection as part of the journey itself and the medicinal qualities that happened during that experience. And they talked about community during integration. In fact, some people talked about community as the most important part of the overall experience. And I've taken out a couple quotes just to read to you all today so you can hear the strength and power of the words. This participant said, "For me, psychedelics are about remembering and re-experiencing safe connection with other humans. There is so much disconnection in the world. So when I meet new people and I'm describing just the beginning of what this offers, I personally emphasize that the healing, the unique healing that comes from doing this work, is community." Other people emphasized the intention of why they were doing psychedelics as something that they were doing to look for community. People said things like, I was looking for a place of tribe. I was looking for people I could connect with. I was feeling lonely. Other people talked about community connection as being meaningful during the experience itself, both in terms of positive experience and in terms of helping them through difficult experiences. And just a couple quotes again for you so you get a sense of the words of participants. For positive experience, someone said, you experience this feeling of belonging, you feel connection, you feel enchanted with everybody that's there. And for a lot of people, this is not a normal feeling. Other people talked about the difficult experiences that happened during psychedelic journeys and how important having people that they connected with there to support them, and also the way that they could support other people through difficult experiences. One person described the power of the journey for them as serving as a compassionate witness for others. Someone else said, of course you fall apart in journey, but when you fall apart in community, you have people holding you. Lastly, people talked about integration and community as an essential part of integration. I was particularly struck by the quotation at the top where someone said that learning about community was almost like a corrective experience for them, and this was a person who had experienced a great deal of trauma in their life. They said community and healthy community created a template that they could then take into their life. So this raises a lot of questions and opportunities from where I sit, and this is the part of the presentation that I usually call the so what. Does any of this matter, right? Why are we spending our beautiful Sunday morning talking about this? So let's just summarize where we are so far. What do we know? We know that we have a crisis of connection. We know that psychedelics are powerful connectors between people and that they have the potential to easily and quickly form community. And we know that our current treatment modalities in clinical trials are biomedically based and for good reasons are individually based. And this creates an opportunity for us as we move forward together to think about intentionally what kind of community we want to create and how we want to harness the power of community to maximize healing. So what does therapeutic literature tell us about community? I looked at some of the literature about group therapy, which most of us have probably been in at some point in our lives, and there's kind of a godfather or grandfather of community, a guy named Irvin Yalom, and he came up with all of these great characteristics of groups, like universality and altruism, and he said, you know, learning that you're not alone in the world, that you're not the only one who suffers from your problems is incredibly powerful. Learning how to both receive and give care is incredibly powerful. And this feels kind of right for me when we think about the communities that we want to create in the psychedelic space. But I think that it's missing something, and so I would encourage us to think a little bit deeper about a concept called moral community. And moral community was developed by someone named Emil Durkheim, and what he said is that people are bonded not just by common experience, but by a moral goal. And he said in a moral community, people embrace mistakes as opportunities. People build relationships with intention and respect. People resolve conflict through engagement. People allow for exploration of complicated feelings and experiences. And this feels really right to me, that there's something moral about what we're all doing here that is more than, as Bia was talking about, just an individually based me, my trauma, my experience. But I want to take the stage to encourage all of us to actually take this even a step further and to think about what MLK called a beloved community. And this is thinking about the community that we create and the power of community, not just in the context of our individual experience, not just in the context of the bigger goal of morality or ethics, but rather to think about community that is based essentially in the context of equity and justice. Martin Luther King came up with this concept when he was working with Gandhi, spending time in India and studying nonviolence. And what he said is that a beloved community is a global vision in which all people can share the wealth of the earth. And in a beloved community, there is no poverty, there is no hunger, there is no homelessness, there is no racism, there is no discrimination, there is inclusivity. Disputes are resolved peacefully. Love and trust triumph over fear and hatred, and peace prevails with justice. This vision of beloved community challenges us to remember that healing is not an individual game, but a collective responsibility. And right there I have the same quote that you have, Bia. none of us are free until all of us are free. And that was a phrase that was uttered a lot in my house growing up. So whatever community we create has to be built on values of equity and justice, and we must consider, of course, planetary health. So 3 quick challenges in my last 2 minutes here. As we define community going forward, we must think about equitable access to clinical trials, to psychedelic treatment, and even think about things like criminal justice reform that we may not think are related to psychedelics, but are extremely related to psychedelics. We must be thinking about group work in the psychedelic space and be bold in designing research and advocating for federal funding of psychedelic research and changing FDA policy that currently only allows, it's only indicated for individual experience. And I heard with joy and awe yesterday that there is a group therapy trial starting in 2022. So fantastic for our colleagues who have made that happen. Lastly, there is the challenge to do no harm, that our community cannot just include other humans on the planet, but must include our planetary community. This is a picture of the Amazon and the clear cut that is happening. We cannot allow this to happen without a healthy world. We have no healthy community. Thank you. I'd like to end just by closing the gratitude circle that I started with, and thank you all so much for inviting me to be here, and thank you so much for listening to my thoughts, and I hope we can have a robust discussion about what we can imagine together. Thank you so much.
Hello, hello. Okay. So we have questions and answers now, so stay there. I think it was great that you ended with showing a picture of the Amazon and just reminding the cultural genocide and what's happening throughout the Amazon, and particularly in Brazil with Bolsonaro at the moment, and all of us plant lovers. There will be no ayahuasca and no plant medicines if there is no Amazon. And so protecting the land, if you like these medicines, you can't really dissociate, as we said, from the land. So I think it's great that you ended on that note. I want to start off the questions and answers, just you can approach, but perhaps I'm going to just ask you to share a little bit more about your study that you presented quickly about community and plant medicine in the US. I thought, can you talk a little bit more about that?
Sure. So again, this was what we call a modified ethnography, and ethnography involves participant observation, which in the context of psychedelic work sounds a little different than what it was. It meant that I was very immersed in the community of plant medicine users in the US. I went to lots of ceremonies, and I spoke to people both who were participating and people who were guiding ceremonies around the US in an effort, again, as an early study to try and understand the culture, community, and processes of psychedelic science in the underground world. And it was an incredible experience. I spent 2 years doing the study and worked with community members to plan and to create the aims of the study as well as all of the methods of the study. And then we together wrote papers and analyzed the data. So it was not just me as a white cisgender person, but rather an inclusive process that included people who have been working in the plant medicine community for generations.
Very nice. So folks can welcome to have access to her paper, and are you ready to make the question, please?
Yeah. Hi.
Hi.
I'm Andrew. I'm also one of the co-leaders of Planned Parenthood, to really focus on community work, especially in the context of family. My question is actually about some of the challenges or the darker side of community. Often folks are drawn to community because they lack certain kinds of attachment and sense of belonging, but there can also be a lot of challenges arising with that, particularly if community has leadership that has some challenges, and we've seen dark sides of collective bonding around, movements that can cause problems as much as it can help. So I wonder if you can just speak to how to mitigate some of those challenges.
Thank you so much for that question. And I didn't talk about the dark side of community. I guess I was being a little blind and thinking about it as I was feeling so optimistic in preparing this. But in fact, of course, we have to think about the dark side of community. And we all have shadow, right? We are all human. Having said that, I think the trick to creating healthy community is to hold, for the entire community, to hold the community accountable. And so where I see a lot of the problems is when there is a leader, there is a guru, there is someone who is in charge in that way in a community without having any accountability. Certainly we've all read about sexual assault in the community, which is something that we do need to think about and talk about openly. I believe personally that having guidelines about proper behavior should be spoken, should be transparent, and then people should be held accountable to them. I'm trying to think if there's anything else I would like to say about it. I do also think that as we move forward, one of the questions that we're going to have to grapple with is training for facilitators in the community and how we want to think about formal or informal processes to ensure that some of the things that are not welcome in our community continue to be called out and removed, including things like unwanted sexual content, including things like racism, including homophobia and transphobia, which are, again, part of our society. And we all do have to struggle with making sure that explicit and implicit bias doesn't make its way into our world without accountability. So it's a tough one.
Yeah, thank you. Also want to invite everybody to pick up a booklet that we have. Chikruna is distributing for free, a community guide on raising awareness around sexual abuse. It's on the table there, so you can just pick one if you feel like it. Can we have another question?
Hey, my name is Justin Carter, and I am one of the founding resident DJs of a club called Nowadays in Ridgewood. And I want... Thanks. I'm going to ask a question that, kind of as it goes with these things, I don't expect that you're going to have like a super thorough answer. It's more kind of like a question for us to consider. But I need to lay some foundation for this. At the beginning, when you were talking about the study, the secondary study that you were doing, you laid a dichotomy between the idea of nightlife as casual and whatever, casual, I'll just leave it at that. And these other group experiences that are more intentional, let's say. But I want to pose the counter to this, that there is a very strong movement within nightlife that centers on political activism, equity, safety for the people who are involved, and sacredness as well. There's certainly people who come who just want a fun night out, and that's okay. And a lot of times we hope to bring those people into something that is more sacred, but there are a lot of people that show up for the sacred within nightlife, and they're using psychedelics. And the question that I want to pose is, how can we embrace that? How can we take this environment where, yeah, there's some casual stuff, there's some maybe like dangerous stuff that happens, but also accept that there's the sacred that's happening? How can we embrace that?
So, yeah, I mean, talk about an example right there of some implicit bias of mine, perhaps, showing up in my talk, and I asked to be held accountable, and I really appreciate that you brought that up, because I do think even when you go out and you have fun, just say you're one of those people who's just out for fun, actually taking psychedelics can be an incredibly meaningful and sacred experience, even when you don't expect it and it's not part of your intention. So I thank you for that comment, and I do think that there is a space here to bring communities together. I encourage people to read some of the work by Joey Palomar, who is a researcher at NYU, who talks a lot about nightclubs and drug use and has a specific focus on safety, which is really where, as a healthcare provider, I get concerned, is about safety issues. And I love that you raised the question to the community, because I really put it all back to you all, is how do we bring our community together? How do we celebrate diversity in all of its beautiful, diverse ways? And that certainly is an example of that. Thank you so much.
My name's Hunt, and I'm an Episcopal priest and the founder of Lagare, a Christian Psychedelic Society. And so my question is about existing religious communities and how we, as a leader, as a Christian leader, for example, can be more present to this movement. And I also wonder, has the church, for example, lost so much moral authority in this country that we really need to start over, as if we're going to engage this?
Yeah. What do you think?
I want to
Sunday morning church time.
I'm going to give a tip. I think like we're hosting a conference called Religion and Psychedelics. I think that, Christian leadership should start by acknowledging the genocide of indigenous people and the Inquisition attempt to close down the use of psychedelics, and, a mea culpa and acknowledgement of our genocide and epistemological, ontological, on all levels, combating traditional indigenous knowledge and plant medicines, because that was one of the major focus of the Inquisition. So I think it starts by acknowledging history.
Love it. I knew you should answer that one. I want to add something on a personal note about that question that I think is important. I was raised in a home with people who were such zealots about their atheism that they considered anyone who was religious in any way to just be sort of a kook. And we were social justice warriors, but spiritual we were not. So here I am, a grown-up, and suddenly a spiritual person, or not suddenly, I was always a spiritual person. I just had to discover it in a different way. And actually, my experience understanding psychedelic medicine has led me to have more compassion for people who come from other religious traditions, because I didn't have a lot of empathy and compassion, and I certainly had a huge knowledge deficit and continue to. So I see us all as brothers and sisters and siblings here, and I would say, no, you haven't lost all moral authority. It starts with accountability, it starts with owning it and moving forward in a way that is pro-justice in all the ways that we can be pro-justice. So thank you.
Thank you. Thank you, Dr. Carolyn, please. Thank you for your research. Thank you for being here.